We will talk about the dorsum of the foot in detail now. The dorsum of the foot, also known as the dorsal surface, is the top surface of the foot that is visible when standing or walking. It is covered with a thin layer of skin that is more delicate than the skin on the sole of the foot. You can easily see and feel the tendons of the foot at the dorsal surface. In fact, the skin on the dorsum of the foot is thin, hairy, and freely mobile on the underlying tendons and bones. This is much like the condition in the dorsum of the hand. The cutaneous nerves, or the sensory nerve supply to the skin on the dorsum of the foot, is derived from the superficial fibular or peroneal nerve, assisted mainly by the deep fibular peroneal nerve, saphenous nerve, and sural nerve. If you look closely, you can see that the superficial fibular nerve emerges from between the fibularis brevis and the extensor digitorum longus muscle in the lower part of the leg. In order to supply the skin on the dorsum of the foot, the medial side of the big toe, and the neighbouring sides of the second, third, fourth, and fifth toes, it splits into medial and lateral cutaneous branches. As for the other nerves, the deep fibular peroneal nerve supplies the skin of the adjacent sides of the big and second toes. The saphenous nerve passes on to the dorsum of the foot in front of the medial malleolus. It supplies the skin along the medial side of the foot as far forward as the head of the first metatarsal bone. The sural nerve enters the foot behind the lateral malleolus and supplies the skin along the lateral margin of the foot and the lateral side of the little toe. The medial and lateral plantar nerves supply the nail beds and the skin covering the dorsal surfaces of the terminal phalanges. Bear in mind the dorsal nerve supply before discussing the muscles. The deep peroneal nerve provides cutaneous supply as mentioned before, but it also enters the dorsum of the foot by passing deep to the extensor retinacula on the lateral side of the dorsalis pedis artery. You can better see it if we zoom in a little. As mentioned before, it divides into terminal, medial, and lateral branches. Both terminal branches give articular branches to the joints of the foot. Now let's look at the dorsum muscles. There are two muscles that are found on the dorsum of the foot. These are the extensor digitorum brevis and extensor hallucis brevis. You can see the two muscles here. Keep in mind these muscles are intrinsic to the foot and do not confuse them with the muscles of the leg that have similar names, that is, extensor digitorum longus and extensor hallucis longus. Looking at the extensor digitorum brevis alone, this muscle originates from the dorsal and lateral surfaces of the calcaneus. As for its insertion, it is a bit more complex as the muscle changes into the tendon and extends through the foot and attaches to the toes. These tendons divide into 4 branches that attach to the distal phalanges of the second, third, and fourth toes. As for the extensor hallucis brevis muscle, it originates from the dorsal surface of the calcaneus, and its tendon finds insertion at the proximal phalanx of digit 1, which is the great toe. As you can see, these muscles are closely related to each other. Opposite the metatarsophalangeal joints of the second, third, and fourth toes, each tendon of the extensor digitorum longus, which is a muscle of the leg, is joined on its lateral side by a tendon of extensor digitorum brevis, the intrinsic muscle of the foot. On the dorsal surface of each toe, the extensor tendon joins the fascial expansion called the extensor dorsal expansion. Near the proximal interphalangeal joint, the extensor expansion splits into 3 parts: a central part, which is inserted into the base of the middle phalanx, and 2 lateral parts, which converge to insert into the base of the distal phalanx. The extensor expansion, as in the fingers, receives the tendons of insertion of the interosseous and lumbrical muscles. If you look at this illustration here, you can see a synovial sheath surrounding the tendons of these muscles, as they are beneath the extensor retinacula. The sheath extends proximally for a short distance above the malleoli and distally to the level of the base of the fifth metatarsal bone. These tendons of both these muscles work with other muscles in the foot to control movements such as dorsiflexion of the foot and extension of the toes. This action of the muscle is possible due to the innervation of the deep peroneal nerve. That is all about the musculature of the dorsum of the foot. Let's look at the arterial supply now. The major artery that supplies the dorsum of the foot is called the dorsalis pedis artery. It is the continuation of the anterior tibial artery and supplies the dorsum of the foot. As you can see, the arteries are closely related to the surrounding anatomical structures. If we remove these structures here, you can see the anterior tibial artery and the dorsalis pedis artery, as well as rest of the arterial network of the dorsum of foot more clearly. The dorsalis pedis artery begins in front of the ankle joint at an imaginary line connecting the malleoli. It is superficial in position and is crossed by the inferior extensor retinaculum and the first tendon of the extensor digitorum brevis. Looking closely, you can see that on its lateral side lie the terminal part of the deep fibular nerve and the extensor digitorum longus tendons. On the medial side lies the tendon of the extensor hallucis longus. Its pulsations can easily be felt in this location. The blood vessel, referred to as the vessel, eventually terminates by merging with the lateral plantar artery at the sole, which results in the formation of the plantar arch. Additionally, there are several branches stemming from this vessel that are worth mentioning. Branches. Firstly, there is the medial and lateral tarsal arteries, which cross the top of the foot just below the ankle joint. Secondly, the arcuate artery runs deeply and laterally to the extensor tendons and is located opposite the bases of the metatarsal bones. This artery gives rise to metatarsal branches that lead to the toes. The first dorsal metatarsal artery is one of these metatarsal branches, which provides blood supply to both sides of the big toe. Finally, the deep plantar artery, which is a terminal branch of the dorsalis pedis artery, dives into the sole between the two heads of the first dorsal interosseous muscle. The deep plantar artery joins the lateral plantar artery to complete the plantar arterial arch, thus forming an anastomostis. Just like how there is a network of arteries in the dorsum of the foot, there are also the accompanying veins that form the dorsal venous arch. The greater part of the blood from the whole foot drains into the dorsal venous arch through digital veins and communicating veins from the sole, which pass through the interosseous spaces. The dorsal venous arch lies in the subcutaneous tissue over the heads of the metatarsal bones. It drains on the medial side into the great saphenous vein and on the lateral side into the small saphenous vein. The small saphenous vein ascends into the leg behind the lateral malleolus. The great saphenous vein leaves the dorsum of the foot by ascending into the leg in front of the medial malleolus. That is all about the dorsum of the foot. We will talk about the sole of the foot next.
Watch our medical videos anytime and anywhere. Download sqadia.com app now.